Hey everyone, get this. Vitamin D is actually not a vitamin but a pro-hormone your body produces when your skin is exposed to sunlight. But despite this fact, vitamin D deficiency is extremely common. In this video, we'll share the major signs to look out for that may indicate your body needs more of this super important nutrient. If you seem to constantly catch every cold, sniffle, and flu going around, it could be a clear sign you're lacking sufficient vitamin D. This vital nutrient plays a major role in modulating and supporting proper immune function and defending against respiratory illnesses. If you find yourself routinely getting 3, 4, or more colds per year, plus the occasional flu, it's very likely boosting your vitamin D levels through sensible midday sun exposure. Consuming D-rich foods and taking doctor-recommended supplements can help significantly strengthen your immunity, especially during cold and flu season. Don't ignore frequent sickness as a clue you may need more vitamin D. Numerous research studies demonstrate that persistently low blood levels of vitamin D are associated with higher rates of depression, seasonal affective disorder, and overall poor mood, especially during the cold winter months when sunlight exposure is very limited. If you find your outlook, motivation, and happiness regularly dip into a slump during the winter, or you're dealing with persistent symptoms of depression year-round, definitely ask your doctor to test your vitamin D levels. Correcting any deficiency through daily supplementation may provide a helpful mental health boost alongside other lifestyle changes like exercise and therapy. Since vitamin D plays a major role in supporting healthy neuromuscular functioning and nerve signaling, low levels of this nutrient can manifest as constant fatigue, overall muscle weakness, diminished endurance, and poor balance or coordination. You may frequently experience having a harder time recovering from your normal workouts. Your legs feel shaky going upstairs, or you're lacking your usual agility and strength for everyday activities. Don't ignore these subtle physical hints that your vitamin D status may be low. Optimizing your levels can make a big difference in your energy and well-being. Unexplained chronic bone, joint, or back pain and an increased risk of fractures or breaks are also clear warning signs indicating your body's vitamin D levels are likely too low. That's because vitamin D promotes calcium absorption in the gut and maintains adequate calcium and phosphate levels for proper bone mineralization. Without sufficient vitamin D, you can gradually lose bone mass density, leading to osteopenia or osteoporosis in adults and even rickets in kids. If you have any unexplained bone or joint discomfort, be sure to consult your doctor right away for blood testing. Pregnant and breastfeeding women have significantly higher vitamin D needs to support their growing baby's skeletal development and future health. But statistics show many still don't meet these increased recommended daily intake levels, putting themselves and their baby's health at greater risk. If you're expecting or nursing, you should aim for at least 600-800 IU of vitamin D per day through cautious midday sun exposure. Consuming vitamin D-rich foods like salmon, eggs, and fortified milk, and your prenatal supplement. Don't neglect your vitamin D intake during this crucial developmental time. Stay tuned as we continue sharing more essential information about the many signs and symptoms that may potentially indicate your body needs more of the powerful sunshine vitamin D for optimal health. There are many clues your body and mind may be signaling that you could use a vitamin D boost. From getting frequent illnesses to depression and muscle weakness, getting your blood levels tested and discussing food sources, sun exposure, and supplementation with your doctor is key to prevent a deficiency. What are your favorite vitamin D sources? Share in the comments and be sure to subscribe to stay informed.